health, they say, is wealth. When you're healthy, you're wealthy. And that brings us to today's edition of the program, Health Guide. The program centers on discussing health-related issues, disease outbreak, cures, prevention, treatment, and what have you. And you're watching us on Global TV channel 276 on StarTimes. I'm your host, Lukman Fauzia. Today we'll be discussing health insurance in Nigeria. And with me is a health insurance specialist, Dr. Moses AYIBIOWU, where he'll be telling us what is health insurance, how can you get insured, what are the perks of being insured. We'll see you after the break.
You are watching Global Television. Global Television is streaming live on Arab side as well as StarTimes channel 276. At Global Television, we have everything for everyone. Global Television, building the nation.
This is Global Television in Nigeria's capital, Abuja, from where we bring you cutting-edge and incisive analysis around politics, social issues, and the economy. We're on StarTimes channel 276. You can follow us across all of our social media platforms. The handle is at Global TV NG. I'm Uyi Agmofwebe.
Welcome back. Now, before the break, we were talking about health insurance in Nigeria, and with me is a guest, Dr. AYIBIOWU Moses. You're welcome to the show, sir.
Yeah, thank you very much.
Thank you.
Yeah.
So welcome.
Yeah, thank you.
Thank you for having us.
Yeah.
Mr. Moses, thank you very much for coming. So, Mr. Moses, anytime I hear insurance, I get all the feeling of my money. So what can you tell us about insurance and how does insurance play a role in Nigeria?
Oh, thank you very much. Insurance is simply defined as security against losses. Insurance is critical to our national life. You know, like I was saying before we start, that insurance is what makes advanced economies to be advanced. Because if you actually do business abroad, you see the role of insurance is very, very key. There is no business you go into where insurance policy is not considered. So it's only in Nigeria you can drive your car avoiding insurance policy. You can own a house avoiding taking insurance policy. You can do many things just trying to avoid taking a policy in insurance. But all over the world is a prerequisite for business. And that is why advanced economies are doing better. Remember, insurance started from when some merchants on the high sea thought about anytime there is a kind of an accident in the high sea, the merchants do lose their wares. And at the end, you know, they are out of business. So after several of these kind of mishap, they came together and said, look, let us come together and do something. Now we shall have to contribute to provide cover for our losses, so that if anybody should be a victim next, that person will be able to recover, because we have some amount we have contributed that we can use as a startup for that person that have just lost had through that mishap. So that practice began until people now started a lot of businesses on the high sea. They now saw that, oh, we can't do without this kind of system. So before the layers of London was established to take care of when the insurance persists, set up to be able to assist and support businesses. So since then, insurance has been playing a pivotal role in any economy. Perhaps in Nigeria, it is important for you to know that insurance is doing well in Nigeria. It's just that our attitude, our policies, that is within government now, is not encouraging more people to key in. But we know that with this incoming administration, we're going to have better policy that will address insurance as a whole.
Okay. So I like it that you mentioned with the incoming administration.
Yes.
Now my point is, how do you enlighten the public on the word insurance, and how do you make them key into insurance? Because you keep saying insurance. Now, mostly when you hear insurance, you always believe it's something that is done outside Nigeria, in advanced countries and all of that. And then I'm asking myself, okay, can insurance happen in Nigeria? What is the criteria for it to happen? Like, how can it even be born in Nigeria?
Oh, insurance has been in Nigeria for a very long time. It's just that the awareness is not everywhere. Insurance companies, there are over hundreds of them
That's
in Nigeria. Different companies, and with the recapitalization and all, we have more than 10 insurance companies doing well. You have Consolidated Insurance, PLC, we have so many of
insurance
Hallmark,
companies.
we have many of them. We have Leadway, just by the corner here, along this road. So they are everywhere. But our attitude towards insurance is what is giving us that outlook that insurance is not with us. Insurance is with us here. You can insure anything. You can insure your car, you can insure your house, you can do, insure your properties, everything. So it is not that it's not available, it's available with us, just as it is available elsewhere or in other climes. But our attitude towards taking insurance is what is the disparity.
Okay.
Yeah.
So now our attitude towards insurance.
Yes.
And I'm wondering, okay, who are the people? What makes it the insurance? And I'm wondering, when does getting an insurance becomes a necessity?
In developing countries, all the developing countries, because of the poor nature of the large population, the largest, the larger the population, the consciousness and the enlightenment, so to say, is not there as is supposed. Because if you look at Nigeria as a case study, we are over 200 million people in Nigeria, estimatedly. And if you look at how those that are insured, in terms of their property, in terms of their the car insurance and all the rest, you find out that so many are still uninsured. Like even in advanced countries. It may interest you to know that during the reign of Obama in the US, Obama came to power riding on the strength of insurance, because he was telling them that, look, that is riding on the strength of health insurance. He told the Americans that it is unacceptable for over 35 million Americans to be uninsured, that if one of his policy will address and provide cover for those 35 million people that are uninsured. So people were happy because they know that some people are still not insured, even in America. So there's no 100% cover. So, but on our part, we need to be doing better as a developing nation. Because if you compare the difference in terms of the coverage between those in America and Nigeria, you know that it is very, very low. So our coverage is low, particularly in health. Yeah, but in terms of cars, we are trying to get there. But if you see even those that are insuring their cars, you find out that they go for the lowest type, third party, where they will pay 5,000.
Exactly.
So because they perceive, their perception about insurance is negative, that a situation whereby you are going to pay a sum of money and it seems you are paying for an abstract goods you cannot handle. Yes. But they don't know that insurance plays out when there, like I said earlier, there is a security against losses. When the loss occurs, that is when it matters most. in case the loss, that there's a probability that the loss may or may not occur. In case the loss now occur, you now have to, the losses occur, you have to pay. You have to now enjoy the benefit of investing your money. It's kind of investment. It's a financial investment. Where you put your money somewhere, it's on that probability that that money will come back. So if it comes back, fine. If it doesn't, fine. But the most important part is that if there's no planning towards your investment, you have invested, so to say, 10 million naira on a car, and that car is on the street, it's on the road.
Yes.
There might be there can be accident that the car might involve in an accident, and if the car should involve in an accident, your 10 million naira is gone. So there's nobody to call upon. But if you insure that car, and that car had such an accident, you can just call your insurance company. Look, this car that I insured had an accident, and the insurance company is duty bound to put you back, to make sure that that car comes back. If it cannot be repaired, if it's damaged beyond repair, the insurance company will provide a new one. That's what they, depending on the type of policy you took with them. But if you insure your car with 5,000 naira, a 10 million car with 5,000 naira, or you took the third party, so you can be rest assured that such, if the car is now written off, you will not be able to get the car back. So what we are saying is that the role of insurance is to bring you back to the state where of your investment before you get into insurance. So it means that anytime you are going to business, you are now dealing with uncertainty. The uncertainty you are dealing with is you are making the provision for that uncertainty by putting some money aside for insurance. So it's very, very important, because you may end up, like I said, those merchants on the sea that lost their wares to the mishap on the sea, on the high sea, lost everything, and they were out of business completely. But when the insurance idea came, and people started contributing somewhere, that look, perhaps any one of us that are doing this trade now, if anything should happen to us, we will fall back on this amount of money we have contributed. So, and they saw that, oh, those people that were now victims afterwards were having a provision already there for them. So, and that is how we should live. We should not live under the assumption that will never happen.
Okay.
Life do happen. Things do happen to us as humans that is beyond our control. And that is why insurance is very key, very, very important.
Okay, so now are you saying for a family man,
Yes.
and you happen to have 5 kids,
Yes.
does that mean you have to insure all of those kids separately, or you just make one insurance that will cover for all of those kids?
Okay.
Because some kids get sick like very often,
Yes.
some don't.
Yes.
So does that mean medical insurance covers all of that, or it just has to be car insurance, car insurance? How does it like affect in the health sector? How can we make them count for it? Like, okay, I have these kids, how do I get them insured? Does it go one after the other, or it's just all of the kids with one name?
Okay, thank you very much. When it comes to health insurance is the most important,
Exactly.
because health is the most critical. Without your health being in place, without you being healthy, you can't do broadcasting.
That's true.
You can't do manufacturing.
Exactly.
You can't do banking.
That's true.
You cannot even do farming. You cannot eat. You can't do anything.
You just
So
can't do anything.
healthcare is number one. That is, your health is, that's why they say a healthy nation is a wealthy nation.
That's true.
Because you cannot lay your hands on what to do and make money. So coming back to your question, that in terms of coverage, everybody must be covered. The principle and the philosophy of health insurance is that the contribution, the pool of funds will be addressing, when everybody is covered, a pool of funds will be addressing those that are sick, and the people that, everybody has done the coverage, everybody are covered, everyone is covered, but particularly those that are sick, those will be the one to benefit. Why? Because we are thinking of looking at the probability, once again, that you will be sick. Sickness will never write to you that, oh, by next week, Monday, I'm going to get sick. It's not possible. That's so, true. But that's why all of us must be on the plan. If you are a father, you are a mother, you have 5 kids, or 4 kids, or 7 kids, you must try and put all of them under the health insurance policy so that all of them will have access to care whenever the need arises. That's what health insurance is about. You are doing a little contribution to the scheme wherever you are, such that you will have access to medical treatment when the need arises. And the need will always come, because after all said and done, after all the going back and forth, doing businesses and all the rest, there will be need for insurance. There will be need for you to take care of your health. You may say that, oh, I will not get sick. What about health checks? What about you even checking to see if you are okay? You know, our attitude in this part of the world is such that you believe that you will never be sick. So some people will say, God forbid. But the truth is that if you can go out there and service your car, put your car, know that I've traveled with this car for, quite some times now. I need to service it. You should know that you that is going up and down, even inside the car, need to be checked also, so that your body will be in good condition for you to continue. So what health insurance promotes is, number one, access. And that is why health insurance has come to stay, such that we are looking at these 200 million people in Nigeria having access, easy access to healthcare when the need arises. We know they will not come once. Like I said, the philosophy of the scheme is that about 20 to 30% will be sick at the end of the day. So that's why health insurance is a business. If you are insuring everybody, all of us are contributing, but not all of us will go to the hospital. All through my period of contributing to health insurance, I was never sick. But one way or the other, my kids do sick, they go to the hospital. So it is very important that we make that provision.
So does that mean when you have health insurance, you have easier accessibility to medical aid?
Yes.
That is what it means.
That is what it means, because depending on the plan, it goes with different kinds of plans. Like the NHI now, the NHIA, under the National Health Insurance Authority, they have their own plans. The one for civil servants, the one for private organizations. So the one you choose provides you numbers of benefits. And from those benefits, when you look at them, you now know, oh, this one will be okay for me. If you are elderly, you know that some sicknesses, some ailments are for the elderly. They don't occur to children. So if you find out that, oh, this plan does not cover those things that I think I should have access to, so you will not take such plans. So you have to look out for those plans and policies that covers your range of, or your group of age limit, age bracket is very important.
Okay, so a little reminder, we're still talking about Institute of Health Insurance.
Yes.
And with me here is Mr. AYIBIOWU Moses.
Yeah.
He said you have easy and accessibility to medical health when you have insurance. And before that, we'll take a break and be right after that. Thank you very much. Welcome back. Like I said earlier on, you're watching Health Guide on channel 276 Global TV on Star Times. And earlier on, we've been talking so far with Mr. AYIBIOWU
Moses.
Moses.
Thank you.
And Mr. Moses have been taking us step by step on how important insurance is to our health. Because like I said, I don't joke with my health, and you shouldn't too. So Mr. Moses,
Yeah.
back on the whole Insurance Institute.
Thank you.
Are there any outline courses that help in guiding people and masses and our precious viewers on how to go about insurances, and what are the educational qualifications of it, or is there any duration for such courses?
Thank you very much. The Institute for Health Insurance and Managed Care of Nigeria was born out of the need to educate the entire country on the significance of health insurance and managed care, because this is a great advantage that must be given. Health is a right. We have right to health care. So it must be given to the masses. That is why we took it upon ourselves that everyone must be knowledgeable in it, because behind the growth of any industry is knowledge. All over the world, there's a focus right now on what we call universal health coverage, that there is no one that should be without access, affordable, accessible healthcare. Healthcare for all. That is the language now. So, and if other countries, developed countries, are trying to make sure that they are 100% covered under the health insurance scheme in their countries. So we too in Nigeria should be doing something in that regard. Up to now, we just have little percentage. You know, in 2015, there's a publication that we have just a little over 6%, which is very low. So we are looking at a situation whereby we will be 100% covered, just like other countries that are doing well when it comes to health insurance. So that brings us to providing some foundational courses, educational courses, because you cannot, behind the growth of any industry is knowledge. You cannot ask a driver that, oh, drive faster, go to 120, when the man has no knowledge about driving. That's what is happening in Nigeria.
Okay.
Many of us are not knowledgeable when it comes to health insurance. There were series of advocacies done at the level of National Health Insurance Authority, at the levels of the National Primary Health Care Development Agency, and even the Federal Ministry of Health. But it's not enough. It's not enough, because we saw the need, and we know that, oh, people are educated better when they have the formal way of training. They can now come to the class, they sit down, they listen to courses, outline for them, examinations is done, examinations are carried out after the courses. So they now see, oh, particularly to the practitioners. If we are talking of the masses now, it is the practitioners that will educate the masses. If the practitioners, the people, the doctors, the nurses, the pharmacists, they cannot even understand what is going on. So how will the man on the street understand?
It.
So that is where the institute comes in. So the Institute for Health Insurance and Managed Care has been able to provide that leadership as the first and the only dedicated training institute for health insurance and managed care in Nigeria.
Thank you very much for that. I like the fact that you mentioned that they are thriving at being the best.
Yes.
So my question now is, who are eligible for
The whole
insurance?
Nigerians, the entire nation is eligible.
Okay, now
Because
I don't know.
what we are looking at is, first of all, taking care of the practitioners, and also getting the masses, the enrollees, people that are going to enjoy the services, educated on what they need to know, so that if you are giving them, instead of giving them 1 cup of rice, you are giving them half, they can question you and say, why? You are a doctor under this scheme, why are you giving us half? You're supposed to give us a full dose. So that is why we have outlined over 50 courses to
Okay,
provide.
so you mean just because you
different
outlined the 50 courses, it means everybody's eligible. I can just wake up like, I'm a Nigerian, I'm eligible.
Yes, you can
No,
just
okay,
come to.
does that mean I don't have to come with my family or have to like put them through, or I just come alone and then my family come alone and then every family comes alone? Like, who are eligible and what are the criterias?
Yeah, when it
Because
comes to education.
let's just assume I'm hearing insurance for the first time and I'm
Okay.
like, okay, is there any need? I'm a Nigerian. Nigerians are good with being careful. Small disease, no, they kill African man. How can you get me out of that shell and then make me see that I am eligible? And then there's a particular criteria for that without me thinking, they just want my money, they just want my money. Why will I be paying money for that? And when I go to the hospital, I will still pay money.
Okay. Like I said earlier, we divided our scope of training into two. The first level, the first tranche is for the practitioners. That is, if you are a doctor, you are in the health industry, you are a pharmacist, you are an administrator, you are an accountant, you are a health worker in any health centers, any of the health centers across Nigeria, you're supposed to know the nitty-gritty of health insurance, particularly those in the rural areas, because the larger part of our population are in the rural areas. So we must provide adequate education for them. Then we now come back to providing same education and enlightenment advocacies for the other sector, which are the informal sector, the mechanics, telling them, grouping them through their associations and talking to them, educating them. And even when it comes to private organizations, looking for how their HR managers can come and take 1 or 2 trainings that will help them to even understand and deepen their knowledge of health insurance. And it's working. And we are grateful to God that, what we have been doing over the years is really bringing people up to speed on health insurance.
I'm glad you said bringing people up to speed.
Yes.
Because earlier on you said when they make insurance, they have accessibility.
Yes.
Now, I would like to know, apart from accessibility, what are the other benefits of being insured? Because I need to know there's something better for me before I can get insured. Like, can you tell us what are the other benefits that come with being insured?
Yes. The first benefit, like I said, is access to care. After your access to care, we talk about number 2, which is qualitative health care. When you have gotten the access, the next level of the benefits you are expecting is that the health care you are getting must be qualitative, so that you're not just going to the hospital, they will just give you what is not. And because you are on health insurance, you are under the scheme. So we make sure that you get that advantage too. That is why we tailor some of our courses to address quality assurance. Like now, one of our courses is what we call quality assurance in health insurance and managed care. That talks about after you have access to the care, how are you going to enjoy qualitative health care, so that at the first instance of getting to the hospital for treatment, you are taken care of in such a way that you don't need to come back again. Because when you are not under the scheme, there's every probability that you'll be treated to come back. Because when they look at you now, you are an Ajia, the way you dress, they say, this one has a lot of money. Instead of us just giving him the food dose, let's give him half. Let's give her half. So that when she goes home and she comes back, she will likely come back before the week runs out. So that we'll treat her again. Maybe that time we'll give her injection. And when we give her injection that time, that is the real thing we're supposed to have done. But we'll not do it for her now, because she has a lot of money. We presume she'll be able to pay a lot of money. So let's do that so that we can make more money. So healthcare has become business. So you must understand that. And because of the health insurance access that people are now getting, that kind of treatment is not acceptable. Because when they are treating you, the third opinion, the first, second, third opinions are there. to checkmate the hospital and say, oh, what about the quality of care given to? Because the health management companies or the health insurance companies, they have their own doctors that will look at what the hospital is doing to be sure that what they are doing is in line with the operational guideline of the National Health Insurance Scheme. So what we are saying in essence is that there are so many benefits. So like first, access to qualitative health care. Three, it promotes preventive care. You don't need to be sick so much that you can't walk before you go to the hospital, because you can now prevent. Once you notice, oh, it seems I notice rashes on my body, you can easily walk into any of the hospitals and take medication because you have access. You are not going to pay any dime. But if you are not on health insurance, if you notice anything in your body, if there's any growth or anything, you can't go. You'll be waiting for your salary. Or I'm not ending, when the month ends, I will have to go to the hospital. But when you are under the scheme, you can go to the hospital anytime. That's what the advantage, one of the advantages the scheme gives to you. So there are so many advantages that you are duty bound to enjoy when you are under the scheme.
Okay, so lastly, I want to believe you've convinced me and our viewers, of course. So if I want to make, like, register or do the insurance, do I just go into any clinic or do I just go into any medical center?
Okay, the first place, if you want to assess care under the National Health Insurance Authority or under the health insurance scheme in Nigeria, the first place you need to go is to go to the NIA office, any of the offices around of national, because they are the umbrella body charged with regulating health insurance in Nigeria. So you can get into any of the offices and tell them, look, I want cover for myself, my husband, and my children. And then they will now print out the list of health management companies under them, because we don't want you to go and fall into the hands of unregistered health management companies. So you can get the authentic list from them, and from the list you can even make inquiries from them, and also on your own you can also check for them, and you now take a decision. But what all the information you need can be given to you at the National Health Insurance Authority offices. But also with us, we also provide such support, because if you are aware of what our institute is doing, you can call us on our helpline. We'll tell you where you need to go, information you need to get, we'll send them to you through email or through your WhatsApp or any other means.
Well, thank you very much. Yeah. Like I said earlier on, you have been watching us on channel 276 Global TV on Star Time, and we have been having a discussion with Mr. AYIBIOWU Moses, and he has been letting on health insurance, because health is very much important, and he said health is wealth, and we don't joke with our health, and that is why we're taking you step by step on how to guide your health, live a healthy life, and prevent a lot of sickness. A little reminder, you've been watching us on Global TV channel 276 on Star Times, and we have been discussing health insurance in Nigeria with Dr. Moses AYIBIOWU. Dr. Moses have given us everything we need to know about health insurance and the perks, which is accessibility. Thank you very, very much for watching, and don't forget, if you love this program, stay tuned. Watch us same station next time, next week. See you some other time. Thank you.